Good morning, everyone. Hope you're having a great week so far. Happy Tuesday, and thank you for joining me on today's episode of Tooth Teacher Tuesday. Hope your new year is off to a great start, and with it being New Year's, a lot of people have made New Year's resolutions to get healthier. Hopefully, dental health included in that, but kind of along those lines of thinking, today's topic is a question that we get asked quite a bit related to our health, which is essentially something along the lines of why does my dentist need to know about the rest of my medical history? Um, Dentists, you're just looking at our teeth, checking for cavities. Why do you need to know about medications and other health conditions? And I hope it goes without saying that even though, yes, as dentists, our primary focus is the health of the teeth and the mouth overall, our best interest is your overall health, and we may be just one part of that, but not only does oral health impact the rest of our body's health, but at the same time, your overall health, certain conditions or medications can be, vice versa, affecting your oral health. Which is why when you go to your dentist, you're probably periodically asked to update your medical history for any new conditions or surgeries or medications so that we have the most current data, most current information so that we can help to properly diagnose and maintain your oral health. So a couple of examples of some things that are of particular importance in dentistry are, we need to know about things such as, if you're taking any medications that are, affect your ability to clot. Various blood thinners out there, which becomes important if, say we need to take a tooth out where it's normal and expected to be some bleeding. For someone on blood thinners, that's going to be excessive, and we need to be able to plan ahead for that and know, whether or not we should take you off the blood thinner for a couple days, or if we should just, have extra wound dressings available to help that to clot quickly. That's just one example. Other examples would be, if you've had any major surgeries recently that could affect, say like surgery for a joint replacement. We've talked about that in the past, why sometimes antibiotics are needed before dental work with artificial joints or artificial, heart valves or, organ transplants. So it's also very important for us to know that. And then there's also just certain health conditions that, again, we've talked about in the past that have symptoms that present in the oral cavity. One example would be if someone's diabetic, they're going to be more prone to bone and gum disease. And so, if we see that, could be, if diabetes is undiagnosed, it could be a sign that we have someone who should get in with their doctor to be screened for diabetes. But on the flip side, if we know someone's diabetic and they've, traditionally had good oral health, and then suddenly we start seeing bone and gum disease, that could be a sign that their diabetes is worsening, or it could also just be a sign that they're starting to slip up with their home care as well. So the list goes on and on. Certainly when we're gathering data and asking our patients for accurate health histories, it's not to be nosy. It's just so that we can best serve you. And I'll leave you with a final one, which is I'll go into more in depth next week. But another thing that we're screening for is patients that take certain medications that affect the ability of the bone to heal. which again becomes very important when we do any kind of extractions or implants or anything else that manipulates the bone. But again, that's a little preview for next week's video. But in the meantime, I hope that kind of clears the air as to why your dentist is asking about your heart and your lungs and everything else in the body. But thank you for the privilege of your time, and until next week, I hope everyone is well, and we will see you then. Thank you.